Beauty is very intimately related to your health. I say that people who chase beauty, they have to realize that beauty is a very fickle mistress. At the moment your health is ruined, your beauty exits your system faster than anything else.
Hello, hello. Welcome back to the Holistic Pharmacy Podcast. I have an amazing guest and conversation in store for you today. I have Dr. Sofia Din, who is a board certified family physician with over 25 years of medical experience and advanced training in geriatrics. She began her career in hospital medicine and long term care, where she served as medical director before shifting her focus from disease management to proactive longevity and anti aging medicine. She's the medical director of Juvanni Medical PC in Westchester, New York, where she integrates aesthetics, hormonal health, and advanced non-surgical technologies to help patients navigate menopause, andropause, metabolic slowdown, and chronic skin failure. So without further ado, welcome to the show.
Thank you. I couldn't have said this better myself.
Yes, yes. Thank you so much for providing that bio. There's going to be more about your work in the show notes. And to start off, I'd love to hear a little bit about your personal journey and how you came to do this work.
Well, just I was very young when I knew that I want to be a doctor. I think the first time I remember wanting to be a doctor was when I was 4 years old. And so, yes, it has been a journey. I have trained in different philosophies. So my initial training was in Pakistan, where I we follow the British system of medicine. So basically, because we were originally a British colony, so all our advanced training is geared to for doctors to be able to go to London. However, I ended up in United States and New York instead. And I basically trained in a very different mode of training, because American system of medicine is slightly bit different. It is the hierarchy and the training, the exams, the stuff that doctors are supposed to know is very different. And it was like a kind of a paradigm shift, because the training of medicine in British training is more like essay type storytelling, and United States is like multiple choice questions, and basically you're thrown a case, and in 90 seconds you have to like decode that problem, and basically problem solving at a very efficient rate. So I think both of those trainings provided me a very solid foundation to practice what I really thought was very interesting to me, was geriatrics, which was aging. And when I went into aging, I realized that it was just very disappointing and dark. And that was the darkest period of my life, where I felt that I could not help anybody. There is no way for me to be able to reverse any problem, because once a problem occurred, we are just putting band-aids on it. And many times we are able to keep you alive, so called. However, you're really not living in that period, because you're just existing. And we prolong your lifespan without keeping you connected with your health and wellness. And there's no U-turn to health and wellness. And even if you achieve health and wellness for a few moments longer, you just go back into you're on that path, which is like a decline. And it was just hard for me to just see that. And then what ended up also happening simultaneously is that there was like this new field of health span and lifespan and longevity treatments that was simultaneously occurring, which were basically just And I think you are probably aware of it because you have that in one of your names. That there were people who were like, how can we promote more health rather than just letting ourselves get sick and then throwing 50 pills at it, at every problem. So what ended up happening is that I started training and looking towards that form of that other path, which was, in my opinion, like a middle path where where health treatments were integrating with the problems of future, which are like aging problems. So I refer to many of my friends and colleagues refer to that path as anti-aging. So we were the people who were like, what can we do to stop this? Because we realized that aging itself is a problem, and it was an inevitability in the 18th century and 19th century. However, in our period of time in the 21st century, we started finding tools and methodologies that allowed human bodies to remain healthy and strong throughout the period of time that they were alive. And that was my journey, where I had to go into the dark side of medicine and train there to realize that there has to be a different path. And I'm so grateful that I was able to find it and go on it. It's hard and complex, and you have to study a lot. And actually, I feel that I have become now a perpetual student of this training. And because it's constantly, improving, and our understanding is improving as we're going through, different realizations. And the best prop to this training is now, in my opinion, AI, which I am extremely grateful for. I am actually a bit disappointed that we are using artificial superintelligence in weapons more before we have started using it in healthcare and longevity. And I have great hopes for our future, because I think that we can really find solutions faster for everyone, because every human that I have met in my experience has been so uniquely different while being similar to each other. And I think that AI will allow us to, have that concierge experience where everybody, like you would need to do PhD in every human.
Yeah, thank you so much for that context, Dr. Din. It's fascinating that now we have the possibility and the opportunity to thrive at any age, where before it felt like there was definitely a natural decline. And being a pharmacist, seeing so many geriatric population on so many different medications, and you have to realize that's also a burden on their organs of detoxification and elimination, and lots of drug interactions that we're just not aware of, that we're probably introducing. And then there's Beer's list and things that we don't want to do for elderly patients to alter their consciousness and increase risk of falls and such. So it gets to be very complex, and it's exciting to know that there's strategies that will give us that health and vitality even through the elderly years. And also, there's like a philosophical shift too that I want to invite into the conversation, where some people may be chasing youth and beauty and vitality and kind of freeze themselves at a specific age where maybe they felt their best, and like they don't understand the concept of aging gracefully, and they just like, are really holding on to this um, group, or this age group specifically, that seems to get a lot of the attention, especially as women, like being in our peak and in our prime. And then sort of when you age, nobody pays attention to you anymore. And there's also a cultural shift around respecting elders or not. And so I'm curious, you as the author of Do We Really Need Botox, what your perspectives are around all of this. And you're also the host of the podcast Bathroom Diaries. So give us some insights about, what perspective to hold as we have this conversation.
Well, that's a your question is like kind of an invitation for me to write my next book on aging, like, aging gracefully, or aging helplessly. So think that this concept of aging gracefully cannot be tied with aging helplessly, because what you need to do in your 21st century is to make sure that you're using the tools that are available to you. These tools and this technology was not available to our ancestors, so it is important for us to have this experience. Again, these are medications for health, just like there are medications for sicknesses. We have now tools and medications for health and wellness also. And you have to make this choice that which path you're going to take. And it's okay. There's no judgment in like what path you choose. You find one, go into the path of aging, see how you feel over there, and then you can still like there you have like a decade or two to make this decision and turn around to health and wellness at any point. So at any point you feel like, oh, my natural stuff is no longer working, I still feel tired. I still have feel depleted and have no energy. What can I do to bring that back? And now you will find places where you will be able to have that rejuvenation, that regeneration. And it is possible medically, however. It is not, it's not something that you can sleep your way through or eat your way through, because these are basically treatments that, kind of bend time for you. And now time eventually will become just an illusion. So another concept that I also like my clients to be aware of is the concept of pausing. The human body is biologically programmed. We're programmed to, once we've done our fertility is over at some point, at 39 we already consider women advanced maternal age, because your fertility period window is closing. And at that point your body is programmed to start experiencing perimenopause, and which after a decade or 15 years will turn, depending on your genetic components, like what happened to your mother and grandmother, it will lead to basically a full pause in your system. So now this biological pause, where for instance in women it's called menopause, where you stop having period for like a whole 1 year, what ends up happening is that that's not just a one system pause where your fertility is no longer working. That pause is an all system pause where many women, actually you will encounter a lot of women in my age group who have paused, and we know that it's an all system pause. It's a brain pause, it's an immune system pause, it's a metabolic pause. You start gaining weight and you can't figure out like how to not gain it, because even though you're doing all the things, it just like everything just collects and sits on you, because your metabolism is like taking a nosedive alongside your hormones. And all of those pauses have an impact on your skin, so your skin starts pausing. And yes, because your brain and your brain, because some of those hormones keep our brains activated, so our light, so it feels like somebody is dimming your light until it is switched off. So that experience that women go through, women before us have gone through silently through these problems, and they would go to their doctors asking like, what's going on with me? And they were lighted at their doctor's offices, because nobody could understand that why are they pausing, what is this trouble. Somebody will develop cancer, somebody will develop autoimmune disease, somebody will develop bone issues, someone will have all of these issues. And nobody could actually figure out that this is like all of these symptoms belong to this one problem, that you're pausing, and it's biological, and you need to like lift yourself out of this pause. So one of my understandings, the deepening in the understanding, is to figure out that these pauses are natural, they're biological, and v- however, for the first time, because we of our awareness and the availability of some of these treatments, you do not have to go down that pause without help. And that help doesn't have to be you changing yourself, having 25 different surgeries, even though that does become like, because women, when they start experiencing skin failure in their mid 50s, they feel like, oh my God, I don't even recognize this person who's staring back at me. And that's the concept of my Bathroom Diaries, where you meet you without a filter and without makeup, and you find yourself in that position of vulnerability, and how to align with yourself, how to love yourself even when you are not feeling the peaks that you had experienced before. And I think that at this point, you also do not have to accept the aging of your system without also knowing that there is help out there. And you are able to go and seek that help. We thankfully have all those elements at our access, because remember, your body is basically just a vessel that's holding your consciousness through time, gravity, and hormonal imbalance. And can we assist you in keeping it healthy as you go through time? Yes, 100% we can. That's at least my experience in United States. However, you have to find people who are trained in this in wherever you are in. I don't know where your most of your audience come from, but I know that pretty much people like me exist now in every country and pretty much the entire planet. However, because this is an out of pocket additional expense, health is an expense, it's an out of pocket expense. However, in United States, if you have medical insurance, your insurance, health insurance, is like your car insurance. So basically, it only activates if you develop a disease or a disorder. So if you have a disease or a disorder, you can go to your insurance and they will cover it. However, health is going to be, it's like an oil change. Your car will be like, go and get your oil change at your own expense, and your, denting, painting, whatever else, cleaning is your own problem. So that being said, menopause in United States is not considered a disease, but a natural process. However, this phase actually leads to a lot of different problems for women. And one more thing that I would like to also insert over here, even though I focus on women health primarily because that's my thing, but I also have studied men's health, and men go through a similar experience in time. Their bodies are pre-programmed to encounter andropause. And andropause is like basically where their hormones tank, their systems start flailing. Men, when they develop like a mid belly, we think that they're very successful, because around that time they were an andropausal man with erectile dysfunction and a little midsection fat is considered a well-to-do wealthy person, because by that time, that's why women find that at some points, like, this man must be doing well. However, andropause, women, what a stark difference that women, by the time they're menopausal, we become we disappear, how and we become invisible. And men, when they become andropausal, they become more visible, because it kind of shows that they have some money. But men's andropause is quite tricky also. And that is because women at least have a symptom when we have a pause. So we know that we are not going to have any more periods. But men, on the other hand, they have no symptoms. They don't know at what point now to start. Why am I feeling tired? Why am I chronically low energy? Why is my thyroid acting up? Why my cholesterol is through the roof? Why I'm gaining 10 pounds, and whatnot. So men have their own problems also. And I do believe that men also, just like women, seek somebody, like when we are not feeling better, because we're vocal about it, we're more attached to our bodies. However, men don't even try to seek that, because they're supposed to be macho macho, and they should never complain about anything. So they have like a different set of problems. And I don't know if that is in the purview of your podcast. But I think that one of my things is also to bring people to this awareness of understanding your pause, and figuring out which layer of pause you're in, and how to lift yourself out of it again and again, because your body will arrest, and you will have like that issue. And sometimes that can happen in your 30s. The girls that I've met, your age group, who go through childbirth, for instance. So right after childbirth, you naturally go into a pause state. Sometimes, if if you have a lot of support and you take care of yourself, there is a possibility that you don't have that arrest in your system. But girls, however, in your 30s, you can lift yourself out with natural things like exercise, sleeping, whatever, and some support. But in your 40s and 50s, that requires a little more extra assistance. I know
Yeah,
it
thank
was
you
a
so
long
much.
answer.
Yeah, yeah, that was very enlightening. Thank you. So, in your experience, what is the reason, or most of the reasons that you are aware of that people seek out practitioners like yourself? Like, what are the cultural and psychological reasons why longevity and beauty are important to people?
So, wh- even though I call myself a whole body rejuvenator, and I believe in the anti-aging of body as a whole, because you're a full system. But one of my most favorite organs is skin. Now, human skin is not just the largest organ of your body. Human skin is also certain parts of your skin, for instance, your face, and there are prime areas. I call it prime real estate, because that's how you recognize you, and how others recognize you as you. However, one very fascinating fact about human skin is that it is represented in your brain, and your brain cells and your skin cells arise from the same matrix of cells when you were very little embryonic tissue ball of consciousness, when you were very, very tiny. At that point, the outermost layer of the embryonic tissue, which is called the ectoderm, half of it turns into your brain cells, and the other half turns into your skin cells. And for that matter, your skin cells and brain cells, in my perception, are quantum entangled at birth. And as your skin goes through time, not only you recognize yourself, your brain learns to look at you and see where you are in time. And your cells of your hair your hair is nothing but an extension of your skin. And so what I like to do, and what I do best, is basically supply treatments and solve issues that can afflict the your skin through time. Now, anti-aging is a different, it is very sometimes closely tied to beauty. But beauty is a totally different topic. I always like to just make everybody conscious about the fact that beauty is a genetic gift. It is something that, nobody, like in an anti-aging realm of work, can give it to you. The only person who can give you beauty is your mother. And that is it. These We can provide you with preservatives to keep you connected with your versions that you find beautiful through time. However, that is an extra thing. And again, anybody who tries to, tell you that they can give you beauty, they're probably guiding you wrong. And so that's my take on anti-aging and removing the aesthetic. However, beauty is very intimately related to your health. I say that people who chase beauty, they have to realize that beauty is a very fickle mistress. It At the moment your health is ruined, your beauty exits your system faster than anything else you would ever know. And for that reason, if you have worked on the dark side of medicine and you've been in the hospital sections and ERs, try and find somebody who's beautiful there, because there's nobody beautiful there. If somebody you find in the hospital that's looking beautiful, you have to go and wake yourself up. Maybe you're watching a movie or something. So the thing is that beauty is like a genetic trait. However, I feel that whatever you are, whoever you are, you need to always love yourself, learn to love yourself, and accept yourself. And once you love yourself and accept yourself as a whole, as a being, as a purpose, as a code that got translated into physicality, at that point you can also, if you're in the 21st century, but in a country which is not which has some of these resources, you can keep yourself together through time a little while longer. We have not been able to turn off the aging, as a switch as of yet. However, we have halted it. And through time, you can halt the disintegration of your system, because remember, your consciousness grows through time and it blossoms to its absolute best around 70 or 80. So, double your lifespan right now and know that by the time you're hitting 75, 80, your consciousness is going to be way amazing than what it is right now. And however, by that time that you reach, your consciousness is there and it has, blossomed into that thing that you can get all the messages from the universe or multiverse, whatever your code represents. Um, at that time, your system is falling apart, because we have not aligned your body to stay constant through time. However, that is the one that we're changing, and we're hoping that that decade, the last 10, 15 years of your life, are not spent running from one doctor's office to the next, or languishing in some assisted care setting where nobody even, you become irrelevant. And we're hoping that the last 15 years or 20 years of your existence, if you find you have you can use energy, and you still have energy and you still have life, and you still can proactively, do whatever you want to at that point. So that's, I guess, the essence of this longevity, pursuit of longevity, is to be able to still do things and not become an invalid at the end of life. But right now, like, as we are telling people, like in New York, they have, I think they're trying to pass that bill which will allow people to have like assisted termination of life, if you feel that you have, like, everything is done and you can't really stay alive longer, and you're done. However, we're hoping that you will never get to that stage, where you're at that level. However, if you do get to that stage, I mean, of course, I mean, the exit should be available. However, um, I don't think that people would want to exit if they still have energy, if they still have hope, if they still have inspiration and motivation, and if their consciousness is still alive and working. and doing what it is supposed to, because I mean, we can't tell people what is your purpose in life, because your purpose is in life during your throughout life change. So every 6 7 years you will find that your purpose has completely altered. The purpose in the last decade was something else, to this decade is something else, the next decade will be something else. However, when you go meet your purpose, we hope that you have the energy to carry it out. If you have the inspiration to even know what it is. Because there's sometimes I used to meet people in nursing homes, and the most depressed people I've met were in the nursing facilities, where they were like, you know they had nothing but regret about different things. And the ones who did not could not express regret were the ones who were blindly demented. No, so they were unaware of what was going on.
Yeah, that's fascinating. Thank you for sharing. And I think the purpose is definitely relevant here in this conversation. And it also depends on one's level and state of consciousness, right? So I hear you on wanting to preserve that and expand that and develop that. And one of the ways is to make sure that you are of healthy mind and body and spirit in order to meet yourself there. So, what happens when somebody comes into your office for a consultation? Like, what journey do you take them through from a functional lens?
Well, I am kind of a menopause and a beauty doctor. So most people seek me my work because I help rejuvenate their skin. So, and usually if skin is failing, we have to figure out what level of pause you're in. And then we basically, check some blood work, figure out what can be done to help you uh, get back into the flow of things. So you're not like pausing, but you're in the flow. And unpause is my thing. So basically, we figure out if you're in that pause. And again, beauty in a pause. So beauty is hard to maintain during a pause. It's hard. It's hard work. And however, it's worth it. If you have a sense of beauty, and if you had experienced a version of self which was beautiful, then I say, you would always miss it. You would always miss that person. You will always, because remember, every subsequent day will take you farther away from that, and the farther away you go, the harder it will be to reconnect to it. So, proactively preserving your beauty is always a good answer. And I always welcome people to, preserving beauty is different than pursuing it and trying to find it in places where it doesn't exist. That is, and I 100% am certain that beauty does not exist in your plastic surgeon's office. It exists inside you, and you have to stay attached to it. And yes, I mean, can it happen that if you've like lost, and you let time go through you, and gravity go through you, and hormonal imbalance go through you, and now you've reached a time where the turnaround will require a plastic surgeon's visit? Yeah, okay, go ahead, do it. I mean, if that makes you feel better. However, I personally am personally not in favor of surgery as the first step towards finding your beauty or preserving it, because I feel that that's not the point. The point of, however, I feel that chronic skin failure is best managed by preventative small treatments that can help your skin not fail. And if you can do that easily, you don't have to cut it. Because remember, cutting your skin is not going to remove the brain cells that still exist inside your brain. And once you chuck your skin out, your brain is going to miss its quantum entangled soulmate that represented it. So many times after surgery, I see sometimes very fascinatingly beautiful women who when they look at themselves, they're like, no, I had surgery, and they can now not fool. It's very easy to fool other people, but it's hardest to fool yourself, because the hardest person to fool will be your own self, because you know your experience, and you know that you got it cut, you did this, and you don't look like it. So even if you're looking nice to others, but if it's not looking nice to your own brain, you won't feel it. So I feel that when you chuck your skin, your brain cells miss it, and you won't be able to fool yourself.
Hmm. Yeah, that's a really good point. So I'm wondering from a sustainability perspective, how early should somebody start thinking about this? What kind of treatments are available? What's the safety profile? And also from like that sustainability and longevity standpoint, how often would they have to upkeep it to maintain that look or that preservation of their beauty or skin that we were talking about?
So your skin is not just the largest organ of your body. It holds every other organ inside it. And guess what? Your skin represents the insides of your health. So if so beauty is again intimately tied with health. If you're not healthy, you're not going to be beautiful for long. So I always say that some of the things that you have to do on your own is to live a clean life, stay away from toxic bullshit, whether it is for a company of somebody toxic, or eating something toxic, whatever hurts your system, don't consume it. Sleep well, move your body, eat real food, be with real people, and pursue under a deeper understanding of self, so that you can find things that inspire you, and always be a perpetual student of life and learn new things daily. However, at some point, when you find that all of those naturally things are not producing the results they used to, at that point, you may want to see certain medical grade treatments that for which you have to go and find a doctor. And I think it's a very sustainable thing. I think it's going to be very beneficial for people, because women spend so much money on bullshit skincare stuff, bullshit products that they apply just to keep the skin tissue alive or healthy. Meanwhile, these tiny little bit of shots can actually totally turn back cellular at a cellular level time for you, and save you from spending tons of money, and basically all of those skincare, many of the skincare products are just hoaxes. They don't do shit to people, especially if you're in a menopausal state. So in a pause, when women are in their like late 40s or late 50s, like 10 years, 20 years from now, you may want to go back to this talk and hear it again. But the thing is that at that point, you may reach out for medical grade skincare to help you. And I think that stopping your skin from aging past 40 is like worthy of a visit to your doctor's office. The other thing is that after a pause, sometimes your gut is also pausing, and a lot of women will feel that no matter what they consume, no matter how good their food and whatever intake is, it's just not producing the results that it used to. And sometimes it's not possible for us, for Mother Earth, to feed 7 billion of us the amount of nutrients that we will need to have like a nourishing long life. uh, it might make sense to produce elements that we can just insert people into your body, for your skin to consume and keep itself healthy, instead of just basically bypassing the gut biome. And that is one of the future that we are seeing. The trends of future are getting infusions for your skin and hair. And people do infusions for intravenous infusion of elements for sports already. They were made for recovery and for, regenerating yourself. People do it for sports, but these infusions are also super important for longevity. And we do have a lot of um, evidence about how important these intravenous infusions are, because whenever anybody is deathly ill and they go to the hospital and they go to the emergency room, the first thing we have to do to recover you and pull you out of your whatever illness is to set an infusion of an alkaline fluid, which changes the internal chemistry of your body from an acidic environment to a alkaline environment, which is like much better for internal body. And what we say to people is that why should we wait until somebody is deathly ill to do an intravenous treatment like this for people? This should be done at a primary care level, at as a longevity measure. But that battle still needs to be fought, because we're nowhere near that right now. I don't think any insurance company is going to cover it, because it's considered like an oil change. So you will see that, in your car, even if you buy a new car, the insurance, the auto insurance may cover for 1 or 2 years oil change, but they're not going to cover it for the rest of the life of the car, because they think that, you should change your car after 5 years. However, human body is a different kind of vessel, and you can never leave it. You can never dump it. So keeping it in good shape is very important, and keeping its chemistry suitable to life and longevity is in your interest. However, I don't think that we are at that point where where it is going to be like something that your insurance will recommend or cover
Yeah,
yet.
thank you. Yeah, can you speak on any like negative side effects or contraindications? Anybody who is not eligible for these kind of procedures and injections?
So, yes, contraindications is a very important part of any procedure, because remember, these are all treatments, these are medical grade. Everything has a side effect, a potential side effect. And for that reason, you always have to make sure that you go to somebody that is experienced. It's like driving a car. Like, what are the contraindications and side effects of driving a car? You can kill someone, you yourself can get killed if you don't know the driver's driving capabilities. You are endangering yourself needlessly. People do it all the time. And if you don't know how to drive, I mean, are you following rules and regulations? So for sure, and I give like another example, like a scalpel, in the hands of a surgeon can save your life. And that same scalpel in the hands of like a 2-year-old can injure someone, including that child itself. So I say that these are tools that are can be exceptionally important when used by the right people, trained people. So you have to find your person. You have to find your source. And once you find that source and you know that they're qualified, then it is good to give it a shot. And you know that's really all that I would say. I mean, the benefits outweigh the risks. That's what you have to figure out. However, I feel that surgery, I mean, if you pick surgery as the first step towards longevity, I'm not, because the potential side effects are just so humongous. Even though we are in the 21st century and we have very good capacity to bring you back out of surgery, and repair and bring that repair about, we still haven't reached that pinnacle of excellence that we can guarantee you 100% success. So always go for the minimally invasive, the least problematic procedures, and always use it in the least amount of quantities I believe in microdosing some of these treatments. And and I know you mentioned my book, Do We Really Need Botox? I invite all your viewers to go find it on Amazon and purchase it. I When I wrote it, I wrote it in 2019, and I basically wrote it to support a nonprofit foundation, which I was trying to create for single mothers, because I felt that a lot of single mothers I would meet were women who were recovering from long careers in marriages, which were coming to an end. And as they were getting ready to go into further into life, they used to feel resentful of the fact that they've wasted so much time in different relationships and so much energy. And I thought that because these treatments are so expensive and out of pocket, many of them could not afford it. So I actually set up a nonprofit foundation just to help them understand like what these treatments are, and to go and seek it. So when you buy this book to find the answer to some of these treatments, you are supporting a single mother somewhere.
Yeah, thank you so much for the conversation so far. And it sounds like the individual pursuit of health and longevity and even beauty is definitely attainable. And it can be done in a minimally invasive way, which is amazing. And at the same token, I'd love to play devil's advocate for a minute and talk about the larger ecological perspective and how these treatment models that we're mentioning with IV therapy and injection and surgery and all the other options available to us, and even that you mentioned in the beginning, AI now being applicable in healthcare, like what are the maybe negative impacts of that, or how can we make them more positive, because we know that they're using a lot of resources including water and including all of the plastic and all of the waste that goes on too in these kind of treatment facilities. How do we kind of create a better, more ecological way that's environmentally friendly for these things?
True. So yes, everything has a component of, as long as human life, human life will create waste. And we are also increasing our lifespan. Our ancestors used to die at 40. We were done, but now when you reach 40, you're not done. You're nowhere close to being done. And I know that there is a subset of those ecological people, mindset people, who sometimes wonder if it is worth it that humans live this long. Why not just exit? Like your God promised you 50 years, exit at 50. But we're not done. We want life is beautiful, life is worthy. Once you get into it, and then now we have found all these mechanisms. So now you get in a car, you don't have to go on a horse or on a carriage somewhere. You don't have to walk a mile to go buy eggs for your family. You don't have to, a lot of these things that took our energy. Our so modern lifestyle has extended our lifespan. So I am a believer in the modern life, and it's all its good things. And yes, it does have certain issues, but I think that using AI, so AI is just a tool, another tool that we have created. How we use that tool is going to matter. So how are we using this tool right now? By killing each other. We do not need to use this tool for killing each other. We need to use this tool to help us in living longer, healthier, and more sustainable lives. So, can AI help us over there? I think it will help us produce less weight also, and maybe even solve some of the problems that production of this waste was doing. So I think that again, it is, it is how we use different technology and tools. So, is ecology going to be a problem? Yes, it may be another obstacle that human consciousness has to overcome, but we should look at it as a tool, and we should, find ways how to use it to the best for the best of humanity, rather than for, worst of humanity. And I think that, these some of these treatments that I am recommending are not that wasteful, actually. Yes, we do need more people who are trained, who can guide people correctly. However, I don't think it actually, what costs more money to us is management of chronic diseases, where people are rendered completely incapacitated in the last 10, 15 years of their lives. And we're using all kinds of medications, productions of those medications, surgeries, and whatever. Like, if you look at the Medicare bills and stuff, it's like the whole life of a person, they have not used this much resources than maybe like the last 1 year of their life. And they've had like several surgeries and this and that. So, how to make this biological being use produce less crap, and use and be more efficient. I think it is a process. We are trying to do better, but I think it is a journey. There are no one size fits all solutions, but I think those solutions are there. And we just have to get to them, and we just have to bring the right people and the right teams to do the right thing for us.
Yeah, it's definitely a complicated question. And it's always like the good of one versus the good of many. And we have to balance that.
Yeah,
And yeah, there is no perfect answer, but I always like to bring the climate and the climate changing and just the awareness of that into the conversations, even when we're
yeah.
talking about individual health. So I appreciate your answers. And if you have just one more minute left, I'd love to do a rapid fire round with you.
Absolutely, I am ready.
All right. So, what's the number one thing somebody can do to improve their quality of life right now?
The number one thing that you can do is to improve your sleep pattern. If you
Awesome.
can help yourself sleep better, you'll be able to recharge and repair and regenerate not just your brain, but your entire body, which repairs itself when you're sleeping. So if you can have sleep hygiene, you are in, you can put yourself back in the flow.
All right. Beautiful. Number two is what's your favorite thing to eat, or maybe like a favorite dish you like to prepare?
Um, One of the my favorite dishes that I prepare is like a bag of beauty. It's an intravenous bag of nutrients that I prepare myself for many of my favorite people that I work for. And it has like a lot of antioxidants, like high dose vitamin C, glutathione. It has like all the B vitamins you can think of. It has some amino acids. It has like a little liver cleanse. It has some magnesium. So when I do that, and I pride myself that that dish that I prepare is preservative free, and it's like sourced in, from some of the best pharmacies that that I've come to know over my decades of experience here in New York. And what I do is that I put it together and I give it to myself and others, and that's that one thing that makes me feel so energized throughout my pause. And I think that it has become like an essential component to my health and wellness. And I feel that it also does not take up that many resources, because I know as a human being, if I ate 24/7 for 365 days, I would not be able to get the nutrients that I put myself, that I give to my system within 35, 40 minutes. And that's my favorite dish in the world.
Wow, amazing. And then lastly, share a fun fact about yourself or maybe a hobby that you do, and then how people can get in touch and learn more about your work.
One of my, well, I have so many hobbies, and my hobbies do like sometimes jump around, but I always come back to dancing. I love how I feel after I dance. And I think it is one of my favorite forms of workouts. And especially, I like to do the viral trends on TikTok, believe it or not. And I have a dance teacher who comes and teaches me, and I call it my lunch break dance lesson. So I always like put it out to my all the people who decide to, follow me for other things. They usually see a dance video, but meanwhile it's me during my lunch break. Instead of taking lunch, I do a dance class. And I love it. And I have found it so helpful for my brain and my body health, that I recommend it to people, to just, lift themselves. It is like one of my adjunct to health.
Amazing. Hashtag IV cocktail and dance at lunch.
Well, yes, I mean, sometimes you can't dance while you have an infusion in, but definitely I feel that instead of going and taking time to have lunch, try to just move your body and dance through
Such a
lunch.
All right. Well, thank you so much for this amazing conversation. I'm going to have all of your links and social media profiles and everything that you do in the show notes. And I think you're also offering a complimentary session for listeners so they can book in to your schedule. Yeah. And I hope that we speak again. Take care.
Absolutely. I really enjoyed our conversation, and I hope to talk to you again. And I'll see you on social media. My handle is on Instagram is Dr. Juvanni. Juvanni is the place where I work. So it's Juvanni. So Dr. Giovanni on Instagram, and you can find me also on TikTok. And on Facebook, you can find me as Sofia Din. It's Sophia with an F. And that's it. I look forward to speaking to you again. Please also consider subscribing to my podcast, which is Bathroom Diaries. I'm sure you will find a lot of useful information for you. We discuss, like, we demystify and debunk different things, and what works, what doesn't work. And I think that your followers might find that very interesting and worth a listen.
Wonderful. Take care, Dr. Den.
Take care. Bye bye. Bye bye.